Psychetruth massage.
So in this video, we're going to work with just a regular chair. So not everyone's going to have the massage chair that we've shown some of the other techniques and stuff in. So what we did is we just took a dining room table, just really any chair that does not have arms, and a pillow. So a nice big pillow, and we're going to lay that pillow on the back of the chair. Now I'm going to have actually Katrina, she's going to face this side. So she's going to straddle the chair and get as comfortable as possible here. So if it feels better for her arms to kind of be crossed in front of her, or if they're down, you as the receiver kind of just need to adjust your body to feel what position is going to be best for you. And so as the giver, you can come back to the back side, and now you have a nice surface to press into. She has a support on the front of her, so she has some options as far as not feeling like she needs to hold her body upright, so she can relax and enjoy the massage a little bit more. And I'm just going to start doing some basic kneading and compression. I'm just saying hello to the back. Since she does have her arms up, which is totally fine, it just gives me a little bit less room to work in between the shoulder blades. So just being a little bit aware of that. And using the palms of my hand, the heel of my hand to walk down along the spine and saying hello, coming all the way down to press onto the sacrum. If you want, you can also do a little bit of compression into the glutes here. You can come out to the sides, the low back, and press in. So really you can do a lot of the techniques that we've already shown in some of the other chair massage videos. And this is a great modification if you're at home wanting to try some stuff out with your partner. And coming all the way up to the top of the spine. Coming up into the neck. And then I'm going to move to one side. And I'm going to go ahead and take my elbow once again and just pressing into that meaty part of the shoulder. Just pressing down and giving some nice pressure. So as the receiver, make sure to communicate with the person who's giving. Oh, that was kind of tense. So, my shoulder my forearm kind of hopped off of her shoulder there. And some of that's tension and some of that's going to be just the position. She has her shoulders raised right now, so it's engaging those muscles a little bit. So Katrina, you let me know, how's this feeling?
That feels good.
Okay. And maybe this feels good to you. Maybe it doesn't. If it doesn't, let's find another position. Maybe bringing the arms down. Just kind of making modifications as you go to make it as comfortable and pleasant as possible. I'm doing a little bit of dual walking here. Bottom hand moving down. Top hand kind of pressing into the tops of the shoulders. Pressing the muscles along the spine, just in and downward. Opening up the shoulder. So I'm not going to do any arm stretches here just because she looks like she's in a pretty comfortable position. I don't want to disrupt that. But if you're wanting to work more into the arms and shoulders, that's actually something that would be totally fine to do while she's sitting in a neutral position with her back against the back of the chair. So I'm working up the spine. And just melting into some spots in her neck. I'm still doing good on the pressure. Mm-hmm. Making little circles with my thumb. I'm just kind of working those muscles out. So if you're working with somebody that's bigger, maybe this isn't comfortable for them to straddle the chair. We'll show you in a minute just having Katrina sit normally, and you can still do quite a bit of stuff there. I'm just using my thumbs to work along the spine into those muscles, the erectors, the paraspinals. And Katrina's a little ticklish, so just being gentle here, moving slow. I'm going to switch to a broader pressure, which is going to feel better for her, not initiate that tickle response. And then working all the way down into the sacrum. And kind of giving some nice strokes. You can come to the front of the chair, or our front of the chair. We can do a little bit of compression downwards here. And I'm kind of squeezing, getting a nice return. Working my fingertips into some muscle tension up here. And if you have headaches or migraines, this probably feels amazing. A lot of tension in these areas normally. And it's good to work gently but firmly. So what I mean by that is make sure you have contact, so you're not working so light that they can't really feel anything. But you don't want to go so deep that you just feel like you're just drilling away. So the receiver really, it's up to them to communicate that. And it's also up to you as a giver to check in and make sure things are still feeling good. So a little bit of traction on the back of the neck here. Katrina's pretty supported. Her chin's on her forearms. Now, if she had her hands down, this may not feel as comfortable for her because she may not have as much support as she would want. And just working out away from the spine and coming alongside of the neck, working the sides muscles here. A lot of migraines and headaches are caused by neck tension. And right now I'm using my thumbs to kind of press in the muscles alongside of the neck and working a little bit onto the front muscles as well. A good litmus test, if you're in the right place, i.e. on muscle and not maybe on any of their veins or arteries. If you feel a pulse, well, you're obviously on a vein or artery, so go ahead and move off of that. You're going to stay more on the muscles. And finding some nice spots here, just kind of thumb presses. And I'm going to do some gentle kneading again. And then we can start from the top again. So doing the same thing to the other side. And once you've worked both sides of the body evenly, you can come and give a nice little close, say goodbye to the back. I'm going to have Katrina stand up so we can show you how I would approach this if it was more comfortable. So go ahead and sit facing that way. It's totally fine to leave the padding here. It's going to feel a little bit more comfortable. She's welcome to go ahead and sit back all the way. And then from here, you have some nice access to the top of the shoulders and a little bit better access actually to the front of the neck and the pecs, the upper part of the chest. So I can do a little bit of finger circles into the pecs just underneath the clavicle bone. And the front of the shoulders. And I can press and come along to one side. And it's always good to kind of just give your partner a little forehead support. So if you're working on the back of the neck, this kind of gives them a little bit more permission to relax those muscles. Give them a base to kind of rest on by placing your hand on the forehead. And we can switch hands and work our thumb into the other side of the neck. And then releasing slowly. And if you want to work on the front of the neck a little bit, you can kind of come and just do some light circles here. If you're interested in learning more techniques about that, we can go more in depth into that in another video. Because again, she's still supporting her head, so it's hard to work on muscles that are still being used to hold up your head or hold up your back. But it still feels good. So. And coming up behind the ear, underneath it. Nice little energetic flushing back down to the heart. So doing some little circles on the front of the neck, the muscles in there. And kind of slowly working up the neck. And you'll start to feel there's some bones down here. You can kind of come in between and underneath the ear. So I'm going to reach around Katrina just so they can kind of see. I'm literally underneath the ear. You can see there's a little divot and crease. And so I'm just going to put my fingers in there. So your sternocleidomastoid, or SCM, comes and connects from here and goes all the way down to the front of the neck to connect into your clavicle. So when you're working this muscle, it's always good to be complete and thorough. It always feels incomplete when somebody works really thoroughly in one area, but then they don't kind of work the full length of that muscle. And then just kind of doing some nice energetic flushing back down. We're not using any lotion right now, so my skin is wanting to grab a little bit more. That's totally fine. And just being careful to kind of lift up a little bit more at the end of each movement. That way you can release the skin as well. And I'm going to work a little bit into the insertion of her pecs, where they come into the shoulders, kind of open those shoulders up. And pushing down. You can kind of squeeze out the arms if you want to. So that's a really good way, if they're not comfortable or can't get comfortable, turned around in the chair, that they can come and still get some work on their neck and shoulders. And again, if you want to finish with some scalp massage or just some little gentle strokes, kind of a little goodbye move, and then resting on the shoulders. So if you want to learn more about massage, Psychetruth has tons of videos on massage, on nutrition, on natural health and wellness. So subscribe to the channel, and please leave me a comment below. I want to know what you think. If you have any further questions, maybe you tried this at home and are still having some difficulties, so let us know how we can help. And if you want to find out more about me and my practice, you can look at my website, austinchairmassage.com. I look forward to reading your comments later and connecting with you online. Thank you and have a beautiful day.